Welcome back to Great Dave's Medical Monday. We want to do a correction on Dr. Reddy's telephone number, his contact information. It is 281-491-0044, 281-491-0044, or you can also find him online at readycardiology.com or readybread.com. Well, as many of us already know from personal experience, allergies are tougher this year because of the drought and mild winter. So what are you taking for your sniffling, sneezing, runny nose, watery eye problems? Welcome back, HEB pharmacist Gina Eubank, to break down the over-the-counter selection for allergies, cold, and flu. Hello, Gina. Okay, when we hear the word over-the-counter, and it's right there, arm's length away from us, a lot of times we assume that means that we can't go wrong with them, they can't harm us.
And that is such a farce. I mean, people think, well, they've put it at such a low dose that it won't hurt me. So, you know, if it says take 1, well, then 4 is better.
Yeah, exactly.
You know?
And that should tell you something. If you're taking 4 and your symptoms are still persisting, that you might not be taking it the right way. When you walk up to the counter and you see all of these medications, I stand there sometimes, and you can just stare at the whole thing. And so I give up and I buy the one that takes care of a multiple of symptoms, even though I don't have all those symptoms. Wrong thing to do?
Yes, yes. And a lot of people, they'll pick one that has, like you said, takes care of most of the symptoms and the most expensive.
Yeah.
They think it's got to be good, you know? And what I suggest to a lot of people, of course, is come speak to the pharmacist and find out exactly what your symptoms are. Then we can make a recommendation.
Right, even if it's over the counter, you don't have to have a prescription to go talk to the pharmacist.
Come see us. We will help you figure out and navigate what is the best option. And, you know, I tell people I like them for cough and cold and allergy season to get the individual products. You know, get the antihistamine by itself.
So you can take what you need when you need it. Okay, a little tutorial on what things do, starting with antihistamines.
Okay, antihistamines, that would be this group over here, Claritin, Benadryl, Zyrtec, that group. An antihistamine, an easy way to remember it is you have a cell, and it's like your body, that medication, it puts a block over it so that cell doesn't see what it's allergic to. So then it doesn't spill out all that mucus and congestion.
Okay. And then decongestion.
Decongestants, that is when you're stuffy and you have pressure up in here, okay? So that will help drain from your sinus cavity, relieve the pressure up here. Also, your sinuses are connected to your ears, so it will help open those up.
Okay, topical decongestants.
Topical decongestants, this is when you have high blood pressure. You want to go that route, or if you're taking a steroid or something like that and it takes a few days for it to work, you want to go with topical, because with the oral decongestants, that'll elevate your blood pressure. So that you have to be extremely careful with that.
That's where it's important, again, to stop by the pharmacist and say, hey, here's what else I'm taking. And you've always said, if you're at the same pharmacist for all your medications, then you have that history.
Exactly. And with the topical, it's very important you do not use that more than 3 days, because then you get what they call rebound sinusitis, which is a fancy way of saying you're going to be even more stopped up if you use it more than 3 days.
Yeah, okay. Expectorants is something we started hearing something about over the last few years.
Expectorants, that's when you have a cough and it's a wet, gurgly cough where your body is trying to have a productive cough to get it moving. And so this would be an example here, the Mucinex. And the more water you drink with that, the mechanism of action, it actually incorporates with the medication, and it helps you move that so that you can cough on demand and get it out of your lungs, because that mucus is a breeding ground for bacteria.
A lot of us also, when it comes to cough suppressants, we get into trouble because our body does do some things to help us. Coughing is one of them. We need to get it out. But when do we decide that we use a cough suppressant?
Okay, a cough suppressant is for that uncontrollable cough where you're trying to speak or say something and you're like, you know, or you're trying to sleep and you can't, because you're coughing all night long. And that's another thing, when you're lying down at night, a lot of times what's causing that cough is that postnasal drip, that tickle down the back of your throat. And that's where your antihistamine would come into play. But the way a cough suppressant works is it works on the control center in the brain that registers for you to cough.
Okay.
And this one, Delsum, it's very important with any of the cough suppressants that you do not open the lid and drink it.
Yeah, more is not better. You got to measure it. That's why it comes with a measuring cup.
Because it has the active ingredient dextromethorphan, and it can cause you to have anxiety, sweating, seizures, hallucinations. I mean, and interact with a lot of prescription medications and like antidepressants, heart medications. I mean, you'll end up in the ER if you're drinking that. It can very quickly go bad.
You just thought your cough was a problem, right?
Right, exactly.
Okay, topical eye drops, because of course we know the watery eyes this time of year as well.
And the mechanism of action with these, it's an antihistamine. So it's a topical antihistamine, and you'll go with this, and if this does not work for you after a couple days, go to the doctor, because you can also take an oral antihistamine in conjunction with that.
Okay, but for any of these medications, if something's not working for you, or it's something that's long-term, because a lot of these medications aren't meant to take every day necessarily.
No.
But if you have a long-term problem, that's when you cut bait. Go get either a prescription product or some other way of dealing with your allergies. And then you want to say something about Flonase and inhalers as well.
Yes, Flonase, you do end up at the doctor. They give you a topical steroid, and a lot of people, I counsel them on it because they make the mistake. It's a nasal spray, and it works by actually penetrating this nasal cavity up in here, and a lot of people, they'll breathe it and they'll go, well, then they end up swallowing it. It goes in their tummy. It doesn't go up in here. So you want to just squirt it and breathe naturally and let it be absorbed.
Yeah, see, we just feel like it's not getting in there good.
Yeah, you're like, I'm hurting bad. I got to get it up there.
But yeah, just breathe normally, and then that gets a good point to know. So again, why it's important to talk to the pharmacist. If you have any questions about prescriptions or over-the-counter medications, HEB pharmacists are there to help you. All you have to do is log on to heb.com/pharmacy to find a location nearest you. Gina, thank you very much. Up next, in her 20s, Catherine Ritchie started to experience symptoms of menopause. Doctors told her that she would never be able to have children. How one doctor changed all that after the break.